Okay, we are going to improvise, you guys. I'm going to try this again for as long as my phone lasts. I think we should be okay. We're just going to go through this a little bit quickly. Karen Anderson here with Aortic Hope. I'm so sorry we had technical difficulties earlier. I'm not too sure why the sound of my microphone is not working on my laptop. So real quick to just review how this is going to go tonight, I'm going to allow our guests, Allison and Jacob with University of Maryland, to go over a little bit about their background. They are going to give you a presentation this evening all about pharmaceuticals and the medications that we typically take as aortic disease patients. We posted all of this information earlier around 5 o'clock. However, there will be a link that will be provided to you, so you'll be able to see this presentation again. And if you have any questions, please hold them till the end. And whatever we can't get to tonight, we will have Allison and Jacob answer them as best as they can during the week. So I see that one of you are with us now. We're going to give it just a minute and let people play catch up again. So sorry, guys. It's going to be a great presentation, so hopefully you'll all join us again momentarily, rapidly, soon. In the meantime, we're just going to go ahead and I'm going to let them introduce themselves, and then we'll get started on the presentation. Hold on one second. Yep, that's going to work. All right, guys, there you go.
Hi, my name is Allison Bathula. I am the clinical pharmacy specialist in the cardiac surgery ICU, so I take care of patients that have aortic disease post-op. This month on rotation, I have with me Jacob. Jacob's a fourth-year pharmacy student, so he's going to graduate in May and go out and be a pharmacist and hopefully come work at a hospital like I do. So he has prepared a presentation on antihypertensives, so talking about the medications, how they work, and some of the things that you should look for. And so afterwards, I think we're going to take some questions and see what you come up with from his presentation. So I'll turn it over to Jacob.
All right, sounds good. Happy to be here. I think that you guys have seen the figures already, but I actually have some added information that I think that'll be helpful for you, and I've set up this presentation to go over it. All right, so I'm going to be going over the different types of antihypertensive medications, the classes, their main effects and side effects that you may expect while taking these medications. The first class that I'm going to talk about is the beta blockers. So there's several different types of beta blockers, but the main effect of all of them is that they slow the rate of the heart, and this lets the heart work less hard. And some class-wide side effects that you can expect with all the different ones include bradycardia, or a slow heart rate. It's its main effect, so sometimes it can get too slow, and this would be a heart rate less than 60. Headache, fatigue. Some people experience depression or possibly sexual dysfunction. So the first category that I'm going to talk about is the selective beta blockers. They're called selective because they primarily work on the receptor that affects heart rate. So they pretty much only affect heart rate, and they have minimal effect on other areas. The most common one is metoprolol. I have the brand names of all the medications listed in parentheses for all of these, but for the sake of time, I'm not going to read all of them. So the most common ones are metoprolol, bisoprolol, and nebivolol. And as I said, these ones primarily affect the heart rate. The next class of non-selective beta blockers includes propranolol and nadolol. So these ones have an additional effect of potentially causing some bronchoconstriction in the lungs. These are some of the older agents, so they're not normally going to be the first ones that you see used for blood pressure. But if you are taking these and you do have asthma, you should be aware of that. And finally, there is another group of non-selective beta blockers that also have an additional effect of relaxing the blood vessels, and this means that they also help to lower blood pressure more. And these include labetalol and carvedilol. And one major possible side effect with these medications is that they have the potential to mask signs and symptoms of hypoglycemia. So if you are also diabetic, this is especially important. So hypoglycemia is a blood glucose of less than 70, And when you start to have a lower blood glucose, you may start to experience fatigue, shakiness, sweatiness, anxiety, or hunger. These are signs that your blood glucose may be running low. If you start to experience any confusion, impaired vision, seizures, or loss of consciousness, these are some serious symptoms. And with any of these, you should take a blood glucose measurement right away. And if it's low, try and get something with some sugar in it to eat. And with all beta blockers, if you stop taking them suddenly, there is the potential to have beta blocker withdrawal. And what happens with this is that you'll have a rebound heart rate, and it can result in your heart rate being too fast or being tachycardic, which is considered a heart rate over 100. And because your heart has gotten used to not having to work as hard and all of a sudden is now working much harder than it was before, it can precipitate cardiovascular events like chest tightness or even possibly a heart attack. So one of the things I did want to point out is that some of these medications are extended release formulations, and those include the metoprolol succinate and the Inopran XL version of Propranolol.
Let me ask a quick question
Sure.
of the beta blockers, if I can. So you can switch a beta blocker and not have to be weaned off. That's not technically considered a
Yes,
just
that's
stopping
correct.
it. So when you are on a beta blocker for an extended period of time, one would suggest to be weaned off of it.
Exactly. So that effect would occur if you're taking one chronically over time and then just stop taking a medication in that class altogether.
Okay, and then what would be your more typical side effects of a beta blocker? I know we've heard some doctors say coughing. Is that typically of the beta blocker? You'll get the coughing, or
so the dry cough is actually associated with the next class of medications that I'm going to talk about. But with the beta blockers, probably the primary ones that you're going to be associated with them is the headache and the fatigue, especially when starting them. A lot of people can feel lack of energy at first.
So it is pretty common when somebody has, especially an aortic dissection, and these are the groups of people we're talking about, dissections or disease, that you might be put on a higher dose because obviously you've had an impact to your aorta. So fatigue would be very normal. And I'm seeing people already writing, I'm watching this scroll, they're like exhaustion, fatigue.
Yep.
So that's very normal. Now, would you say that over time that should get better? And if it doesn't, then you would talk with your doctor, because there would be other types of, not every beta blocker is going to give you the same exhaustion.
Right, and I'd say that's exactly correct, and not everybody is the same as well. So while these are things that are consistent with the type of medication, it can vary from person to person too.
Okay.
So that's always, if something is continuing to be of concern or getting worse, that's always something that you should talk to your doctor about.
Okay, I will let you continue.
All
Thanks.
right. So the next class of medications I'm going to talk about is the ACE inhibitors and the angiotensin receptor blockers. They're commonly referred to as ACEs or ARBs. And I have them put together because they actually work on the same pathway that normally causes high blood pressure. So they have a very similar side effects, and they both have the same end result, is that they prevent the constriction of the blood vessels and they prevent retention of water, which both help to lower your blood pressure. And because they have both of those effects combined, a lot of times these will be like one of the first agents that you see people put on. So some side effects that you can experience with all of these is the potential for low blood pressure, although if you're having trouble controlling your high blood pressure, that might not be something that's going to happen. These can cause elevated potassium levels in the blood, the dry cough that you were talking about. There's the potential that these medications could cause kidney damage, and then a symptom called angioedema that I'm going to go over. So these are the different types of ACE and ARBs. There's a lot of them. The most common ACE is probably lisinopril. You can pretty much always tell when something is an ACE inhibitor because it ends with the suffix PRIL or pril. And then there's a lot of different ARBs as well. The most common ones are probably losartan and valsartan, and they actually all end in the suffix ARTAN. So I'm not going to read all of them, but they are there for your reference. And in terms of the differences between the two classes, the ACEs tend to have a higher incidence of that dry cough, and the ARBs tend to have a higher incidence of low blood pressure. And generally, having low blood pressure is a potentially more serious side effect. So people are normally going to be started on an Ace, and if they can't tolerate that, then they'll normally go to an ARB. So one thing of note with these medications is that they are not recommended for use in pregnancy. And then as well, down here I have listed some of the more serious side effects. So elevated levels of potassium can cause weakness, numbness or tingling in the extremities, chest pain, or irregular heartbeats. And if you experience any of those symptoms, you should definitely talk to your healthcare provider. And then also I have a picture here of angioedema, which is the swelling in the layers underneath of the skin, and it can cause the things that you see here in this picture, such as itchy, raised rash or hives, swelling of the face or lips. And this is definitely something that you should contact your healthcare provider or go to the emergency department for if it does occur.
I'm learning so much because I am on I'm on the ARB, so I'm on losartan, but I'm also, I've seen one of my drugs says potassium sparing.
Yes.
So I'm missing 3 feet of my intestine, the small intestine, which would absorb that type of, I guess, mineral, and so I don't want to lose potassium. I always want to keep my potassium, and so I never really paid. This is so great. I don't know. I'm so excited, you guys. I'm learning so much.
So there are potassium sparing diuretics that help you retain the potassium, but in this case, if these can result in higher potassium, and someone was also on only that one that was also retaining potassium, those could work together to both raise the potassium levels at the same time.
Very
so that's
interesting.
something to be aware of.
Okay.
So the next medications I'm going to talk about are the calcium channel blockers. The main effect of all of these drugs is that they relax the muscle of the blood vessels to help lower blood pressure. Some class-wide side effects that you can see with these are headache, lightheadedness, sensitive gums can actually occur. And there's 2 different main types of calcium channel blockers. The first is called the dihydropyridine type. I wouldn't worry too much about that class, it's a chemistry name, but the most common ones in that class are amlodipine, nifedipine, felodipine, and nicardipine. And there's actually a lot of different formulations of these drugs. But some side effects that you can see with this class specifically are flushing, edema, which is retention of water, and that can pit like in the lower extremities, and fatigue. So the next group of calcium channel blockers is called the non-dihydropyridines. So the main ones in this class are diltiazem and verapamil. Some side effects that you can see with these are constipation and bradycardia, or slow heart rate, as I had mentioned before. So the non-dihydropyridine agents have an added effect of a negative effect on the heart rate. So you can kind of think as non-negative, they slow the heart rate. And some options for people that are experiencing constipation while taking these medications, I have listed there. These are kind of like the most benign agents that you can use. Miralax and Docusate are safe to take every day, and if you need to go quicker, you can take Senna at night, and then most people have a bowel movement in the morning. So one thing I did want to point out is that verapamil actually has interactions with some foods and other medications. Specifically, it has an interaction with grapefruit juice. If you do drink a lot of grapefruit juice, it's something that you should talk to your doctor about. And I have listed at the bottom all of the extended release formulations of these medications. There's a lot of them. So if you're on any of those, it's good to be aware that those are an extended release formulation.
So I'm going to ask another question, because this was brought up by a cardiologist, which I did not know until a couple years ago, that these medications, unlike Tylenol, which might start within 30 minutes, they don't start in 30 minutes. Some might take 2 hours to start, some might take 4 hours to start. I know amlodipine sometimes is quicker. So can you talk real quick, before we go to diuretics, a little bit about the different drugs and the varying start times, and which would explain the importance of taking it always at the same time?
Right, so that's always going to be different with every drug. I think in terms of it's it's going to be important which one you're taking. I'm not sure if someone had a question about a specific medication that maybe we could focus on.
So beta blockers, different ones start at different times.
Yeah.
Okay.
A lot of your beta blockers work pretty quickly. As
Okay.
opposed to like your ACE inhibitors, so your lisinopril is actually a little bit slower onset. There's a drug that is dosed several times a day called captopril that is not used as much outpatient, but it works a lot faster. So if you need a more quicker onset ACE inhibitor, that's an option. So it depends on the medication. It oftentimes depends on how often it's dosed each day. Can kind of give you a clue on if you have a drug that's only dosed once a day, it's going to take a little bit longer to work, and then it's going to stay in your system for 24 hours or so. So yeah, they all have different onsets of time, and it may be just 1 to 2 hours difference, but that's really important when, especially if you're having symptoms or if you're on a lot of new medications and they, your doctor prescribes medicine and you take them all at 8 o'clock in the morning, and then you get lightheaded and dizzy around 10 o'clock in the morning. Well, that's important to talk to your doctor and say, like, maybe this is too much in the morning, and maybe I need to space them out through the day, or take some in the morning and some in the evening, and kind of equilibrate yourself a little bit.
Which is also why it's important not to skip anything, because even if you think that your blood pressure, if it's running normal or low, and you take your medication, might take a couple hours before it comes into effect, so that there's a specific reason why your doctors are giving things to you at the certain times of day they're giving them. But if you're having these side effects and you're journaling what your results are, you can always bring that to your doctor to discuss making changes.
Right, and if you're not taking it as it's prescribed, it's really hard for your provider to keep track of how it's actually working as well.
That's a good point.
Yeah.
Okay.
All right, so the next class of medications that I'm going to talk about is the diuretics. A lot of times they're also referred to as water pills. So the main effect of these medications is that they increase urinary sodium, and this causes increased water losses. So wherever the salt is, that's where the water stays. So if the salt is in the urine, you're going to make more urine. If you've got more salt in your body, you're going to retain more water in your body. And the main effect of this is causing increased urination, and while it may not be the most desirable effect, it's actually not a side effect, it's the way the medication works. So the first class that I'm going to talk about is the thiazide type. The most common one of these by far and away is definitely hydrochlorothiazide. Some side effects that you can see with these medications is sleep disturbances. This is primarily because sometimes people have to get up during the night to go to the bathroom while taking it. Some people experience sexual dysfunction, and electrolyte imbalances is a potential problem with all diuretics, because the more you pee, the more electrolytes you get rid of with it. The next type that I'm going to talk about is the loop diuretics. These are a bit more potent. The most common one is definitely furosemide. Same thing with these side effects. You can see electrolyte imbalances. Some people can experience hypersensitivity reactions to this medication, and at really high doses, probably not going to be anything you're going to see like out in the community. You can experience damage to your hearing, but it's generally reversible. So there is one more type of diuretics called potassium-sparing diuretics. The ones included in this are spironolactone is probably the most common, but you may also see eplerenone or triamterene is a lot of times used in combination with other medications. Some side effects that you can see with these, they're called potassium sparing because you retain your potassium on them. So you can see elevated potassium. So with that, you have the potential to have the same side effects that I had talked about before with the Ace and Arbs. Some males can experience breast tenderness or swelling. It's a side effect called gynecomastia. Some people can experience the disorder of menstruation. Some people can experience sexual dysfunction as well. And it's because this medication actually has some hormonal effects as well that you can see these. So some counseling points that I wanted to point out for the loop and thiazide type diuretics. So their main effect is increasing urinary salt to increase urination. So if you have a low salt diet to begin with, it could reduce your need to use these medications at all. With these ones, you may need to supplement your potassium because one of the main effects of the lupin thiazide is the potential for electrolyte imbalances, including low potassium. And you should contact your doctor if you're experiencing diarrhea or vomiting or decreased intake of fluids, because if you're not getting enough fluid and these are making you get rid of it, it's possible that they may want you to stop it for a short period of time. And for the potassium-sparing diuretics, I just wanted to point out that you should avoid excess potassium, such as additional supplements or salt substitutes. Salt substitutes are normally very high in potassium. And men should report signs of breast tenderness or swelling. So down here, I have some potential symptoms of low potassium, which includes fatigue, muscle spasms, abnormal heart rhythms, and rhabdomyolysis, which is a word that describes the breakdown of muscle. So if you're experiencing any unexplained muscle soreness or pain, it may be a sign of this symptom. And over here I have some foods that are high in potassium. So if you don't want to take a potassium-containing supplement, it's possible that if you just supplement your diet with some foods that are high in potassium, that seems we've lost the light, but we're going to keep going. All right. If you supplement your diet with high potassium-containing foods, then you likely wouldn't have to do that. All right, so the last couple of medications that I'm going to go over is clonidine. So clonidine can be very, very good at lowering blood pressure, but it also has the potential for a lot of side effects. So a lot of times it's not going to be the first agent you see used. Its main effect is that it stimulates the central nervous system to relax blood vessels. And because it works on the central nervous system, it can have some sedative effects. So a lot of times you see this medication used for other things as well. So some potential side effects you can see with this drug are low blood pressure, slow heart rate. Some people experience dry mouth, constipation, nausea. There's the potential for fatigue or dizziness and confusion. And one of the most important things with this medication is that you take it as prescribed, because if you miss doses or you just stop taking it suddenly, there's the potential for rebound hypertension to occur. So the way that this drug works is it kind of down-regulates a system, and your body compensates for that. So if you stop taking it all of a sudden, your blood pressure will go back up, and it will actually potentially go up higher than it was before. So you should never suddenly discontinue this drug, and if you're going to withdraw this medication, it needs to be weaned off gradually. Some formulations, there's a lot of different formulations of this drug. You may see it in immediate release tablets, extended release tablets, or patches as well. And the last medication I'm going to talk about is hydralazine. The main effect of this medication is a direct relaxation of the vascular muscle, which helps lower blood pressure. Some side effects that you may see with this medication are low blood pressure, chest pain, edema, like I talked about before. It's the buildup of water that can potentially pit at the lower extremities. Fast heart rate, nausea and vomiting, and potentially diarrhea. One unique characteristic about this drug is a syndrome called drug-induced lupus syndrome. So this is a drug-induced autoimmune disorder that can be caused by taking this medication. It only happens in a very small amount of people, but it's important to be able to recognize it if it does happen, because it can be serious if it's not addressed. So if you're taking this medication, you experience fatigue, rash, joint and muscle pain, fever, weight loss, or a combination of these side effects, it's a sign that potentially that this mechanism is going on. The good thing is, though, that this generally just resolves itself after you discontinue the medication, so there's not too much to worry about. And then I just had a couple of general talking points that I wanted to touch on that I think are just useful information. So what to do if you miss a dose. It's definitely, I'm sure it's a lot harder to take things on a schedule than people like to admit. And when you miss a dose, it's good to know what you need to do when that happens. So there's a lot of different recommendations for different medications, but I have some general rules that you can go by here that should pretty much keep you safe overall. So for extended release medications, which you can normally identify by a suffix after the medication name, such as like ER, SR, XR, or XL, with these medications, you're normally just going to want to skip the dose and resume a normal schedule later. It's because these medications slowly release over time, so you definitely don't want to be overlapping or doubling up on any of these. And just as a added point with these, you never want to crush, cut, or chew these medications. These medications are specifically designed to release slowly over time, and when you manipulate them, it changes how they work, and it has potential to just dump all of the dose at once, and that would be bad because they're actually packing a higher dose than normal into there to be slowly released, and if you manipulate the medication, it's potential that it's just going to release all of it at once, and you definitely don't want that to happen. So for medications that are dosed once daily, if you miss your dose, you should take it as soon as possible. Unless your next dose is within 8 hours, then you should just skip it and resume your normal schedule. And for medications that are dosed twice daily or more frequently, you should take it as soon as possible, unless your next dose is within 4 hours. And then at that point, you would just want to skip it and resume a normal schedule. So, some considerations for over-the-counter products. People generally think as over-the-counter meds, supplements, and herbals as being benign, but this isn't always true. All of these different types of medications and supplements have potential to interact with your prescription medications. And many over-the-counter products can contribute to high blood pressure themselves. So I've listed here some products that you can get over-the-counter that can potentially help contribute to raising your blood pressure. So NSAIDs like ibuprofen, naproxen, they can actually cause you to retain some water, so which can contribute to high blood pressure. And pseudoephedrine and phenylephrine, which are generally used for colds, are actually stimulants. So they can contribute to raise your blood pressure as well. I've listed some herbals that can also contribute to high blood pressure. So some of those, just to name a few, are ginkgo, ginseng, ephedra, or St. John's wort. And also, some people would be hard-pressed to give up their caffeine in the morning, but caffeine and energy drinks can definitely contribute to high blood pressure as well if you're drinking a lot of it. And when in doubt, you can always ask your physician or your pharmacist if any over-the-counter products you want to take could possibly interact with your drugs, because your pharmacist has your list of medications. And lastly, I just wanted to touch on when you should seek out medical attention. So most people take medications without side effects, but some will have them, especially if you're having to take higher doses or lots of combinations of medications. Most start shortly after starting the medication, but others can present gradually or later on. Taking doses as prescribed can help prevent side effects, and it also has the benefit of helping them work the way they're supposed to. So you should always seek medical attention if you experience hives or rash, wheezing or trouble breathing, swelling of the face, lips, tongue, or throat, chest pain or tightness, if you're feeling confused, if you have dark urine or black tarry stools, yellow skin or eyes, and just in general, if anything is just continually getting worse or worrisome to you, you should always contact your healthcare provider. So that wraps up all the information that I wanted to go over, and I think at this point we'll just field questions.
Yeah, I think that was wonderful. I always get amazed 4 years in that I'm still constantly learning things, and the way you've broken it down, it's really going to mean so much to myself and to many others. So I'm going to focus, I guess, right here on Jacob, and let me ask some questions. Now's the time if you have questions to ask them. Okay, so Nancy says she has an aortic root aneurysm 4.6, getting it checked this year. Let me see if she's okay. And it says brother had aneurysm surgery and now had a dissection, and is on amiodarone. Am I saying that correct?
Amiodarone.
Do you want to speak to that at all? I know that, Nancy, you're asking if is 4.6 bad. That would not be probably an appropriate question for this group, and that's all relative to what your doctor feels would be bad for you. But we can talk about that drug a little bit if you want, just to say anything.
Yeah, amiodarone is used for an irregular heart rate. So patients who have atrial fibrillation just means that your heart is not beating at a steady pace. It takes odd beats. So amiodarone is used to keep your heart in normal sinus rhythm instead of out of atrial fibrillation. So it doesn't, it can affect your blood pressure a little bit. Oftentimes it'll make you a little bit hypotensive, and it can certainly affect your heart rate. But it's mainly for patients with atrial fibrillation as opposed to just the general population that has a normal heart rate.
And we're getting a lot of comments. I'm going to butcher. Yes, thank you. That one, metoprolol, nifedipine. Okay, I'm trying to remember how you pronounced all these just a few minutes ago, and I'm getting exhausted all the time. Is it better to take them, if you're told to take a drug once a day, is it better to take a drug in the morning or take it at night, especially if it's making you exhausted?
Yeah, I think if it's making you exhausted, I would take it at night. If it's a once-a-day drug, it's going to last all day long. So again, with all of these medications, we can tell you what the side effects typically are, but they're very different with each person, each patient. So it's kind of trial and error. But I would try to take it at night, especially if it's something like a beta blocker or cardizem, because it lowers your heart rate. And the trick to those, and what they always try to do is counsel you in the beginning and say, like, if you just can push through it and work through it, your body will get used to it. But it's really hard, and especially in the beginning, because your heart rate maybe is not used to being as low as it is now, and your body doesn't really like that, so it has to get accustomed to that feeling.
So if you are taking one drug a day, it is okay if you choose to just take it at night, just to avoid any of that feeling sluggish or any of the side effects you feel.
Right, just as long as you're taking it around the same time each day.
Okay. Somebody here switched from valsartan, yes, to, thanks guys, you're making me say all the names of these drugs. Valsartan to candesartan, and notice that the BP is higher now and has some weight gain. Is that something you could speak to? I know you can't voice an opinion, but she made the switch, but is that a typical side effect? Maybe going from one in the same category to another, you can develop a different type of side effect?
Yeah, I mean, yes and no.
Yeah, I would say for the blood pressure, it may just be that the right dose is not achieved yet.
Okay.
So anytime that you're switching, even from one agent to the other that's in the same class, obviously there's different dosing, so making a clean dose switch, even if we have good recommendations on conversions, oftentimes we still have to titrate that. So for that perspective, it may not be the right dose yet.
So speaking to that, how long, so if someone switches from valsartan to candesartan, how long do you need to give it to let that drug really get into your system and see the levels and see the effect before you should tell your doctor, hey, I've been on this X amount of weeks and I'm seeing higher blood pressure now?
Yeah, I would say probably 3 to 4 weeks is a good, at least chance to see that that's allowing you to adapt to everything else. So kind of see what else is going on in your life, because at any given time you can be really stressed and really hypertensive, and then 2 days later you're not in that situation anymore. So I would give it a good month just to make sure that that's appropriate.
Okay.
But as far as weight gain, not that I can think of that would cause just switching from one to the other. Most of the side effects that you see are class effects. So if you have some type of an adverse effect on one, you typically see it in the same class if you're switching. So that one stumps me a little bit.
Betsy, you're stumping everybody. But I don't know how long ago, Betsy, you didn't mention how long ago you made that switch. So if it was under a month ago, I would say, like you're hearing here, give it a month and then maybe log it different times during the day and then let your doctor know. Kevin just is stating a comment on amlodipine and losartan 3 years out from a type B dissection and is exhausted all the time. Takes the amlodipine in the morning and the losartan at night. Is there a preference? Do doctors just have a preference for amlodipine in the morning, or could you literally just take both at night? Would they work the same way if you took them both at night?
Yeah, they work the same way. They may have separated out just a little bit to make sure that you're not dose stacking. So 2 starting at exactly the same time,
Okay.
the onset at the same time, is potentially why they spread that out a little bit.
That would be something to mention to your doctor, because I've never heard that terminology, dose stacking. So I'm thinking, if he at least discussed that, if Kevin discussed it with his doctor, maybe they'd even say if you took one afternoon and, you know, instead of morning and then night, maybe did afternoon and then night, and then maybe you're saving all your tiredness for just at nighttime.
Yeah, and checking blood pressures throughout the day would also give your doctor a good idea of, okay, I'm comfortable changing from the morning to the evening. Are you taking both in the evening, or taking your blood pressure the first thing when you wake up in the morning, so that we can make sure that, because your body relaxes overnight, and even it's a perfect example in the hospital. We see patients' blood pressure drop overnight because they're relaxed, and of course we have continuous monitoring then. And so you have to think that the same thing happens when you're at home. And so if you're checking it first thing in the morning when you get up, before you start getting like moving and stuff, and are able to kind of see your blood pressure throughout the day, then I think that would make them more comfortable to kind of switch things around and see if that makes a difference in how you feel.
Is it dose stacking if you take a beta blocker and an ACE inhibitor at the same time? Or is it not, because they're two totally different drugs? I'm asking that for myself, because I just pop my Bisolic and my losartan in the morning, and I pop them both at night, and I don't even think twice about it.
Probably be more so if it was the labetalol or the carvedilol in combination with your ACE inhibitor, as if it was just like the metoprolol, because there's more difference of what they're trying to accomplish there.
Yeah,
Okay.
blood pressure.
Yeah, because nobody ever told me to take them apart, so I just didn't. I just knocked them back.
And for some people, it's completely appropriate. I mean, you can't take medication all day long. You
Yeah.
can't be popping pills 6 times a day. That's
Right,
not
right.
feasible. So it's not that it's a wrong thing at all. It's that you may have symptoms, or especially if you're having symptoms and it's making you tired, or you feel like your heart rate is way too low at certain times in the day, then maybe that's a trigger that, oh, it's not good to take these at the same time.
Okay, that's good to know. Okay. Let me see. All right. Betsy said she's been on the one drug for 3 months and just made the switch to the one that made the switch. I can't remember the drugs. It's been 3 months, and she's still seeing a higher blood pressure and weight gain. So that sounds like something to discuss with the doctor. Okay. Okay. All right. For you guys that are still with us right now, if you have any questions, now would be the time, because I seem to have come to the end. It's just been a lot of exhaustion, fatigue, exhaustion, and I know that's what you guys feel. So if we don't see any additional questions pop up here, then I think we will just allow you to type them in as people continue to watch the video. And as I said, the presentation, we will get a link to post. And then if there's any questions, you guys will be more than happy to answer them for people.
Yeah, absolutely.
Yeah, of course.
Okay. All right, so then I'm going to just say thank you so much, and thank you for dealing with the technical issue that we had, and we'll be getting my laptop fixed, obviously. But thank you so much. This was a really wonderful presentation. I love all the information. You did a great job. It was very, it was easy to understand, and I'm sure we'll have additional questions as people continue to watch the video. So thank you again so much, and we will see you, I guess, in the new year with the next live event. Take care. We'll talk to you soon. Bye-bye.